grew up with the World Service as the soundtrack to my life. We were never really cut off so long as we had the BBC.
That's where we'll heard the real news, a window to what's going on in the outside world.
I can be out in the garden raking leaves, doing kind of mindless labour, and yet it feels as if I'm being put in touch with them.
This is BBC News with the latest headlines for viewers in the UK and around the world. Pfizer's vaccine has been approved by regulators for use in the UK and could be rolled out across the country next week.
It will start with the most elderly and with people in care homes and, of course, their carers to make sure that others don't catch it.
The UK expects to have millions of doses of the vaccine against COVID-19 available by the end of the year, with the first 800,000 coming next week. England's tier system has made a comeback, but with toughened measures. More than 55 million people are living in the strictest two tiers. Downing Street for more details on the vaccine developments which we've been hearing about this morning.
May I first introduce the colleagues who are with me this morning. On my left is Professor Sir Munir Pirmohamed, Professor of Medicine at Liverpool University and Chair of the CHM's Expert Working Group on COVID-19 vaccines. That's the Commission on Human Medicines, the government's independent advisory body. And Sir Munir will provide more detail on his work shortly. On my right is Professor Wei Shen Lim, Professor of Respiratory Medicine at Nottingham University and Chair of the Joint Committee on Vaccination and Immunization, subgroup which has been preparing advice on COVID-19 vaccines. This briefing has been called to announce that the Medicines and Healthcare Products Regulatory Agency has this week recommended to the UK government, on the basis of the advice of the Commission on Human Medicines, that it should agree to the approval for use of the COVID-19 vaccine developed by Pfizer-BioNTech, together with the conditions for its supply and use. The MHRA's recommendation has been reached following an extremely thorough and scientifically rigorous review of all the evidence of safety, of effectiveness, and of quality of the Pfizer-BioNTech vaccine. The UK government has now accepted this advice and has made the decision to approve the vaccine for use with some conditions in adults aged 16 and over. The safety of the public will always come first. And I emphasise again that this recommendation has only been given by the MHRA following the most rigorous scientific assessment of every piece of data, so that it meets the required strict standards of safety, of effectiveness, and of quality. We have 2 or 3 slides this morning to help our discussion. The development of this vaccine has been adapted so that the trials are overlapping and the next one can start before a particular phase has finished. And in this way, we have been able to progress development in the shortest time possible. And I would like to tell you a little more about this just now. It's been done using a process known as a rolling review. A rolling review can be used to complete the assessment of a promising medicine or a vaccine in a situation where time is of the essence. That doesn't mean that any corners have been cut. No. Then in October, the preclinical analysis data became available. That's the 3rd bar down, followed by the interim analysis on the 10th of November. The quality analysis came very shortly after that, and most recently, the batch testing has begun, with a final analysis at the very end of the process. So it's very clear that separate teams have been working in parallel to deliver the most rigorous review of this vaccine. No corners have been cut. and then down to the final sampling. We've also reviewed and agreed the prescribing information so that the public and healthcare professionals are very clear and can be very confident that the vaccine is being used in the correct way, uncritically assessing every piece of evidence. Munir.
Thank you very much, June. So I chaired the CHM's expert working group. And first of all, I'd like to thank the members of the expert working group who worked with me tirelessly with over 40 hours of face-to-face, on Zoom at least, committee work, surveillance of the vaccine after it is used. And this includes the use of yellow cards, as well as a special active monitoring program, which we will be inviting people to join. The committee also considered that no specific precautions were required on administration of this vaccine in people who already have had COVID-19, and no testing is required before receiving the vaccine. Thank you, June.
Thank you, Sir Munir. Now I'll turn to Professor Lim Wei-Shen to tell us about the work of the Joint Committee on Vaccination and Immunization.
Thank you, June. The Joint Committee on Vaccination and Immunization is an independent scientific advisory body. We advise the Secretary of State on the provision of vaccination and immunization services. As a committee, we've been meeting regularly over the last few months. We've been assessing. These include data on vaccine safety and efficacy, but also how COVID-19 has impacted the UK. This includes impacts of COVID-19 in care homes, on people from different ethnic groups, as well as people in different occupations. All of that expertise also informs JCVI's decision-making. For the first phase of the pandemic and its vaccination program, we are suggesting that vaccines are offered in order to protect people who are most at risk of dying from COVID-19, because by doing so, we also protect lives. The advice is divided into two main parts. The first is to offer vaccination according to the estimated risk of dying from COVID-19. The risk of dying from COVID-19 is very strongly associated with age. Age is by far the single most important factor in terms of risk from COVID-19. The second strand to the advice is regarding implementation of the vaccination program. And we advise that due attention is paid locally to mitigating health inequalities. I'll say more of that in a moment. Prioritization order in terms of the offer of vaccination. Residents in care homes for older adults and care home workers are the highest priority. Following that are those 80 years of age and above, alongside frontline healthcare and social care workers. Then come those 75 years of age and above, followed by those 70 years of age and above, alongside people who are clinically extremely vulnerable because of specific health conditions. We suggest that community teams work together to mitigate against health inequalities that might occur in relation to ethnicity, deprivation, or access to health care. We also recognize that there may be operational reasons why the prioritization needs to be more flexible. And this may relate to vaccine characteristics or vaccine supply or exceptional personal circumstances. Overall, we have good news today. We have a vaccine that is acceptably safe and effective. Good vaccine uptake will save lives. Thank you.
Thank you, Professor Lim. Let's now turn to questions from the media. And our first question comes from Fergus Walsh of the BBC.
Oh, right. Thanks very much. Question for Dr. June Rain. Can you reassure the public that they can have absolute confidence in this vaccine, given how quickly you've approved it? And for Professor Wei-Shen Lim, can you just sum up for me the reasoning behind your list of priorities about who gets the vaccine first?
Thank you. A really important point relates to the thorough work, scientifically rigorous, methodologically sound that the agency has done. And the way of working in a rolling review ensures that our teams of clinicians and scientists are working in parallel to complete all the work according to strict guidelines on safety, effectiveness and quality is complete. Prepare and prepare. We started that in June. By the time the interim results became available on the 10th of November, we were at base camp. And then, when we got the final analysis, we were ready for that last sprint that takes us to today. And that is the exemplary nature of the work that's been done.
Thank you. So in relation to the offer of vaccination, prioritization was based on the risk of dying from COVID-19, and in order to protect the most vulnerable, we have prioritized the most vulnerable individuals first. The other element is protection of the NHS, the health and social care system, because by protecting the NHS, we also protect lives.
Morning.
Good morning. Thank you very much. Can you explain for me why the MHRA has been able to authorise this vaccine so much faster than the European Medicines Agency and the Food and Drug Administration? Is there any difference in the levels of evidence that was submitted or the checks required? And secondly, how long is the lag, or is there a lag, between being given the vaccine and for it to become effective?
Thank you. I'll take the first question and then turn to Sir Munir. The way in which the MHRA has worked is equivalent to all international standards. We are well aware of our national situation, and therefore we have mounted teams, built our capability and worked in parallel. And I want to thank the colleagues who've worked day and night, weekends, to enable us to come to this position. The public can be absolutely confident that the standards we have worked to are equivalent to those around the world.
The vaccine requires 2 doses, 21 days apart, and from the data that's been presented to us, people will be immune 7 days after the second dose. A partial immunity does occur after the first dose, and we can see some protection occurring after day 12 after the first dose, but the best immunity is 7 days after the second dose.
There will, of course, be longer-term follow-up to provide further reassurance from the data, the robust data we already have.
Good morning. My first question is to you, Dr. Rain. This is a pretty historic moment. You've approved this vaccine in record time. I just wondered how much of a momentous moment this is for you and indeed for science. And then a question to Professor Lim. This is on the priority list. Can you confirm that care home residents will indeed still be the first to receive this vaccine, given how unstable it is and tricky to move to care homes and care home residents? Or indeed, will NHS staff actually, in fact, be the first to receive it?
Thank you. I'll take the first question, if I may. The reason we're here today is the brilliance of science and also the altruism of all those people who have enlisted in clinical trials. Commitment and extremely high scientific standards of all the staff at the MHRA who've worked on this, and the privilege of having an expert advisory outreach, our Commission on Human Medicines and its expert group chaired by Sir Munir. So it is the culmination of all these things that the UK is able to bring together and to look always to the public for whom this is for. Professor Lim.
Thank you. The JCVI's advice is aimed at maximising benefit from vaccines, and therefore it's aimed at the most vulnerable people, which are people in care homes. Whether or not the vaccine itself can be delivered to care homes is obviously an important point, and there will be some flexibility in terms of operational constraints. The JCVI's advice is that every effort should be made to supply vaccine and offer vaccinations to care home residents. Whether or not that is actually doable is dependent on deployment and implementation.
Thank you. I wonder if, Sir Munir, you would like to add, because clearly while the responsibility of the MHRA relates to the standards of science, we also look at it in the context of the real world, which is what Professor Lim has described. Sir Munir.
Yeah, so we did obviously look at the stability of the vaccine. As you said, it is stored at minus 70 degrees, but we were able to look at stability data, and there's stability data showing that it is stable for a short period of time at 2 to 8 degrees, which allows it to be transported to the relevant vaccination sites.
Thank you. Let's now turn to the next question, which comes from Gordon Rayner of the Daily Telegraph.
Thank you. Can I ask, have you identified when? Do you know when the first vaccine will be delivered? Which day we can expect that? Have you identified the first person who's going to get it? And if not, how are you going to decide who that person will be?
Are working again tirelessly to make sure that the first vaccine will be delivered as soon as all the checks are completed. I can speak for the National Institute for Biological Standards and Control, who are ready to complete their checks on the first batch. So everything is being looked at 24/7 to enable this important public health step to be put in place as soon as possible, not a minute wasted. Dr. Lim, would you like to talk a bit more about your perspective on this?
As far as I understand, the NHS is working hard to deliver the vaccines as soon as possible. But that is not within the remit of JCVI to impose any time limits on vaccine delivery.
Bear in mind too that many thousands have already had the vaccine as part of clinical trials. So there is a continuum here, and our knowledge of benefits increases over time. So perhaps it will seem to be a historic moment when the first person, after the approval of supply, has their vaccine. But, Sir Munir, we see this very much as an ongoing process.
Absolutely. So it is very much an ongoing process with regard to this vaccine and future vaccines coming through in order to be able to make sure the relevant people in the JCVI list are given the vaccine in the priority order that was shown.
This is a good point for me to stress that we will be inviting members of the public to join us in an active monitoring programme, and many will get a letter.
Good morning. A couple of things. We appear to be getting authorisation for this vaccine ahead of our friends in Europe. I was just wondering, does the fact that the UK is no longer part of the EU, did that make any difference to the speed with which you were able to complete your authorisation?
Let's turn to Professor Lim around availability. Is there anything you'd like to add on this?
Yes, so it's a very good question about vaccine supply and availability. The whole reason why a priority listing is required is because we expect during a pandemic that vaccine supply will be limited in the first instance. And so vaccines should be offered in the first instance to the most vulnerable moving down the priority list. We will need as many vaccines as we can get, not just in the UK, but globally. And this includes more than one vaccine type in order to reach all the people who are at risk from COVID-19. So this is the start of a program and not the end of a program.
Historic moment, the UK is now one step closer to providing a safe and effective vaccine to help in the fight against COVID-19, a virus that has affected each and every one of us in some way, and this will help to save lives.
That this vaccine, produced and developed by Pfizer-BioNTech, meets rigorous high standards of safety, of effectiveness and of quality. The public's safety has always been at the forefront of our minds. Safety is our watchword, and it will always continue to be so. Thank you. We can now conclude this briefing.
And that was Dr. June Raine, Chief Executive of the Medicines Regulator, the body which has given approval for this Pfizer-BioNTech vaccine, pretty much ending that science briefing as she started it with a focus on the safety, saying public safety has absolutely always been the top priority. She said that no corners had been cut. A lot of information in that briefing. Let's go through it now with our health correspondent Naomi Grimley, who's will take part in an active monitoring programme of the vaccine. So this is the follow-up, isn't it, to see how people are coping with it.
That's right, and that is absolutely key because this is a novel pandemic, so we need to keep monitoring those people who have the vaccine. And of course, a big part of what they were trying to do today was stressing that, you know, people need to buy into this, they need to be able to trust it. So promising us that they will keep looking at those who've had it, checking for any after effects is key. But, you know, also a very important thing that they wanted to stress, I think, today was that they want to prioritise your risk of dying when they're looking at how to roll it out. So I think perhaps most interesting of all was that they talked about paying due attention to health inequalities. These are things like your access to healthcare, whether you're in a deprived community, also ethnicity. So they've got these strict tiers that they want to adhere to, but also they're going to be folding in other aspects of society to make sure that those most at risk get it first.
So do we think, based on that, that some people who don't strictly fall into that category, an obvious one would be children under 16, for example?
It's clear that they will factor that in. Also, I've just been reading the document they produced alongside this. They're going to pay attention, once they've done the over 50s, they're going to pay attention to occupations. So this is things like, do you remember in London, we had, you know, some terrible deaths amongst London bus drivers. It's things they're going to be looking at professions too.
Very interesting, Naomi. Thank you very much for that. Naomi Grimley, our health correspondent. Now, England has returned to a tiered system of coronavirus restrictions after the national lockdown ended at midnight.
Only to queue for hours as they waited to be tested for the virus. Everyone's hoping the vaccine will be available soon. It could be in the next 2 weeks. Peter Bowes, BBC News, Los Angeles.
China has successfully landed a probe on the moon in an ambitious attempt. Now, looking ahead to our coverage throughout the day, the Prime Minister will lead a coronavirus briefing from Downing Street later. It's going to cover today's vaccine announcement and the 3 tiers of restrictions in England. We'll bring you that live in a special programme from 4:30 this afternoon here on the BBC News Channel and BBC One. Right now, it's time for a look at the weather forecast. Here's Carol.
Christmas, baby. Is it Christmas yet? That's what Christmas means to me, my love.
Feel the magic.
Merry Christmas!
This Christmas on BBC One and iPlayer.
This is BBC News. I'm Joanna Gosling. The headlines at 11. Pfizer's vaccine has been approved by regulators for use in the UK and could be rolled out across the country next week.
The MHRA's recommendation has been reached following an extremely thorough and scientifically rigorous review of all the evidence.
The UK expects to have millions of doses of the Pfizer vaccine available by the end of the year, and the first 800,000 coming next week.
Is that, you know, 2020 has been just awful, and 2021 is going to be better.